Hello, my name is Elizabeth. I'm a nurse practitioner student with Maryville University, and this is my health assessment. This is my patient. We have already got her vital signs, her height and weight, gave her the opportunity to empty her bladder. She's in a patient gown, as you can see. Vital signs were all within normal. We did the Snellen's eye chart, which tests cranial nerve number 2. And general inspection, just sitting here looking at her, she doesn't appear to be in any distress and appears to be a healthy female appropriate age that was stated. So we are going to start with the head to toe assessment. We will start with the head. So I'll start by washing my hands. And I'm going to start by just kind of feeling your head and palpating your scalp, just making sure there's no bumps or swelling or edema or anything like that. Is that okay?
Yep.
Okay. So I asked my patient permission before palpating. I'm now palpating her head. I don't feel any bumps, any swelling or edema. As I'm doing this, I'm also looking at her skin. I do not see any rashes, any acne. She does have freckles. Otherwise, everything looks good there. Her head is normal cephalic, so that is also reassuring. The next thing that I will do is I'm going to go and test some of your cranial nerves. To do that, I'm going to go ahead and have you smile, clench your teeth, stick out your tongue, wrinkle your forehead, way up high. Okay, perfect. There you go. And then clench your eyes, close them tight, 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 tight. Okay, and puff out your cheeks. Perfect. So those were all related to cranial nerve 12. So we have done that. And now after the palpation of her head, I'm looking at her hair. It's silky, it's fine. When I palpate it, it doesn't feel brittle or anything like that. So all of that looks great as well. So the next thing I'm going to do is move on to palpation of your forehead and the frontal bone and your sinus cheekbones there, okay?
Okay.
Okay. Any pain or tenderness here?
No.
Okay. Any pain or tenderness here?
No.
Okay. Now I'm going to test your TMJ joint. Go ahead and open. Way open. There you go. And close. Open again. And then go with your jaw side to side. Okay. Perfect. With that, there was no crepitus or clicking noted. Next, I'm going to go ahead and have you close your eyes. Do you feel this up here?
Yes.
Do you feel this here?
Yes.
Do you feel this here?
Yes.
Do you feel this here?
Yes.
How about down here?
Yes.
Okay, and here.
Yes.
Okay, and that was testing for light sensation. All that, when I went on each side, did it feel about the same? Any differences?
Same.
Okay. I'm going to go ahead and what I want you to do is I have something here that has a little bit of scent to it. I want you to go ahead and plug one nostril and sniff. What is it?
Alcohol.
Okay, next one.
Alcohol.
Okay, perfect. So smells intact. Next we are going to move to the eyes. I'm going to go ahead and start by just inspecting her eyelashes and her lids, and those appear normal. I don't see any concerns. They're appropriate color. Next thing I'm going to do is look at the sclera and the conjunctiva. So what I want you to do is I'm just going to bring your bottom lid down here. I want you to look up and to the left, up and to the right, up and to the left, up and to the right. Eyes appear a little bit red, but I'm guessing it's allergies because kind of have a little bit of watery eyes as well. So you can take Claritin for that, and that will help with that itchy, watery eyes as well. The next thing that I'm going to do is palpate the lacrimal apparatus. Okay? And no swelling or tenderness noted. Also, what I'm going to do is when I looked at her sclera, there was no yellowing noted, and her conjunctiva was nice and pink. So next thing I'm going to do is I'm going to do the Rosenbaum test. So can I go ahead and have you read the letters and numbers off this card?
596B.
596B, yes, and that's correct. So her near vision is intact. Next thing that we're going to do is pupillary responses. So what I'm going to have you do is just go ahead and look at a point on the wall there, And you're gonna have it in your eye twice, the light, okay, just a quick across your eye. Okay, ready? Perfect. Great, now this side. Perfect. Next thing that I'm gonna be doing is I'm gonna look into your eye at your optic disc. And that will show me just the veins and the arteries and the optic disc and your red reflex. I do have to kind of get close to you, and this can be uncomfortable because the light has to be in your eyes for so long. But if you need a break, you just tell me, okay?
Okay.
Okay, you're going to feel me touch the top of your forehead here. And red reflex is present. Optic disc. Is visualized, and the margins are within normal, good margins noted, veins and arteries noted as well. So now I'm just going to come on this side, okay? And again, if you need a break, you just let me know, okay?
Okay.
Okay. Sorry, I know, maybe a little uncomfortable. So all of that looked reassuring. Veins, arteries were visualized, looked good. I didn't see any hemorrhages or any other concerns in the eye, so that's all very good. The next thing that we're going to do is I want you to look at my finger and just follow it with your eyes. So we'll go this way, come back, this way. I'm going to go ahead and cover your eyes. This is called the cover uncover test. So I'm going to cover one and then I'll uncover it, okay? And look for a certain response and I'll talk to you about that.
Okay.
Okay. Okay, good. No lateral movement noted there. So again, very reassuring findings. Now the next one we're going to do is I want you to look straight at me, okay? And I'm going to have you look just straight at me and tell me which hands, which left or right is moving, or if both. Ready?
Okay. Left.
Okay.
Right. Both.
Okay.
Both. Left.
Okay. So her peripheral vision is intact as well, so that looks great. Next thing that we will do is we will move on to the ears. So I'm just going to look in your ears first. I'm going to look on the outside here. Okay, so as I look at your ears, I don't see any redness. They're appropriate in color. I'm looking behind the ears. I don't see any areas of concerns as I touch here. Does that hurt?
No.
Okay, any tenderness?
No.
I don't feel any masses or deformities noted. And then I'm going to look in your ear here. Okay, so, okay, and it doesn't hurt when I go up like this?
No.
Okay. Okay, so nice and curly. We like it a gray color. It looks good. The tympanic membrane appears to be intact too, so no concerns there, okay? And again, does this hurt at all?
No.
Okay, hurt when I do this?
No.
Okay, good. Again, same thing. No areas of concern. Nice and intact and pearly gray. So all reassuring findings. What I'd like for you to do next is we're going to do something called a whisper test. And what that is I want you to go like this in this ear over here with your fingers, okay? Okay, and then just repeat the word back I repeat to you.
Cat.
Okay, let's switch sides.
Frog.
Perfect. So the whisper test was good and that was reassuring as well. if I had a tuning fork, I would go ahead and get it going right now, and I would set it on the tip of her head, and I would wait. I would ask, do you hear this in both ears? And she would tell me yes or no, and then I would ask her to tell me when it stops, and that would be the Weber test. And then after that, I would do the Rhine test, which I would get the tuning fork going again. I would take it and I would hold it on the mastoid bone, and I would ask her to tell me when she stops hearing it. Once she stops hearing it, I would take it off the bone and bring it towards her ear and ask her to tell me when she stops hearing it again. And she should hear it twice as long through the air as she did through the bone. So unfortunately, I don't have a tuning fork here, so that's how I would perform that test. The next thing that we're going to do is we are going to look in your nose, okay? So I just want you to look up, and you're just going to feel me. I'm going to palpate, no tenderness here.
No.
Okay. And I'm going to go ahead and just lift up. Okay. Let me try. Okay. Kind of consistent with the allergies, a little bit reddened, a little bit of swelling, and then some drainage. Again, Claritin or allergy over-the-counter medicine can help that. So we can talk about that more after we're done here. The septum appears to be midline, so that looks good. We already tested patent, so you can smell with the alcohol wipe, and that was good as well. So next we're going to move on to the mouth. So the first thing I'm going to do is take my tongue depressor here, and I'm going to have you go, ah. I'm going to look along her mouth here and just look in the, along the gum lines in the buccal area, and all of that looks good. Her teeth appear to be intact, and they're nice and pearly white. She's not missing any teeth. Okay. Now I'm going to have you go ahead and stick out your tongue for me. Okay, I'm going to have you move it to one side, move it to the other. I'm just going to kind of lift up. Okay, no lesions or sores noted. That also looks really good. I do want you to look up for me so I can peek at your hard and soft palate, and that looks great. Now I'm going to kind of look back. I want you to go, ah.
Ah.
Okay, now you're going to have a gag reflex. Ready? Okay, gag reflex is present. Uvula is midline. Tonsils do not appear enlarged. There's no exudate or redness. Mouth is nice and pink. So again, all very reassuring findings. No lesions noted. And I know this sounds weird to say, but no strong odors, which could tell us a problem of tonsils or things like that. So posterior pharynx is pink, and your teeth look like they're in good repair, and you see a dentist regularly. So tongue is nice and pink and moist and symmetrical, so no signs there. The and the gag reflex were measurements of cranial nerve 9 and 10, so that's reassuring. I'm going to go ahead and have you swallow now. Okay, any difficulty?
No.
And that's a measurement of cranial nerve number 9. So we got those down. Next, we're going to go ahead and do a inspection of the neck, because we'll start our neck assessment. So looking at the neck, I see it's symmetrical and there's no jugular vein distension, which is all great findings. The next thing I'm going to do is move on to range of motion. I'm going to ask you to go ahead and lift your head up and down and move it to your left and to your right. Okay, now come back to center. Go ahead and move to the left. So good. Oh, sorry, I did opposite, but you got what I meant.
Yeah.
So again, very normal findings. Your active and passive range of motion is within full, so that's good. Now I'm going to have you shrug your shoulders. Okay, go ahead and drop them, and then shrug against my hands. Okay, good. Now I want you to kind of lift your arms up just a little bit here. I want you to push and pull. Okay, and push and pull. Okay, so great. Again, all very normal findings. Now I'm going to go ahead and palpate your carotid pulses, and I'm going to do just one at a time. I'm putting my hand on this side just to stabilize her, but I am not palpating both at the same time. And then I'll switch again. Looking at her trachea, palpating it, it's nice and midline, no concerns there. I'm going to try to palpate the thyroid gland. It's easier if you come from behind. Have you look up a little bit? Okay, and go ahead and swallow. Okay, and the thyroid was not able to be palpated, which can be a normal finding, so no concerns there. Okay, so now I'm gonna go ahead and palpate your lymph nodes just to make sure you don't have any swelling of the lymph nodes. I'm gonna start with the pre and post auricle lymph nodes, and I don't feel any that are swollen. I'm gonna move to the occipital. I'm gonna come back to the tonsillary and the submental and the submandibular, the superficial chain, and then down into the post-cervical, and the supracervical, okay? And again, I do not feel any enlarged lymph nodes. To do the deep cervical ones, I want you to put your arms in your chest and kind of hunch forward for me, please. Thank you. And so now I'm palpating the deep cervical, and I don't feel any concerns there. So now we will move on and listen to the carotid and the thyroid. Okay. Okay. Again, very reassuring findings. So next we're going to move to your upper extremities and just an inspection of them. So I'm going to go ahead and look at your hands and your arms here. Good hair distribution throughout, not overly. There's freckles noted, appropriate skin color. The cap refill looks good. Her radial pulses are nice and strong and equal. I'm going to go ahead and have you squeeze hard as you can, harder. Okay, there we go. Her strength is nice and equal in both hands, strong, and skin of her arms is nice and appropriate in color. I'm going to go ahead and just kind of peek at your shoulders here. Okay, freckles noted, but otherwise everything is nice and appropriate. So now we will move on to the radial, or we did the radial, we'll do the brachial pulses. I did forget to mention too that when we were doing the hands, her nails look nice and strong, they're not brittle, so that's also very reassuring. Brachial pulses are good, and we had already checked the radial, so now we'll move on to the back, and we will do the posterior chest. I'm going to go ahead and have you lift up your shirt here just a little bit for me. Okay, so when we do the back, I'm going to go ahead and inspect and look, and it's nice in color, no bruises, bumps, masses noted. She does have a birthmark to her lower back. No concerns with that at this time. So the next thing that I'll do after looking at her back here, I'm going to go ahead and I don't see any distress or accessory muscle use. I'm going to go ahead and palpate. I'm going to start by putting my hands at the base of her lungs. I'm going to go ahead and have her take a deep breath in and out. And my hands move appropriately with that, so that's a good reassuring find. I'm going to go ahead and just palpate. No tenderness as I palpate here?
No.
No? Okay. And then I'm going to go ahead and I'm going to do test for tactile phrenosis. Go ahead and take it, same 99.
99.
And again.
99.
Okay, so again, reassuring findings. So now I'm just going to percuss down her back. And I'm going to have you, I didn't do the 99 on your lower lung field, so go ahead and do it again.
99.
Okay, perfect. So now I will do the diaphragmatic excursion. When we do that, what we're looking for, I'm just going to have you turn a little bit. I'm going to percuss down until I feel the lower border of the diaphragm. And with that, go ahead and take a deep breath in for me. Okay, I would mark that spot. Go ahead and breathe. Let her take a couple of deep breaths. And then I want her to exhale all of her breath out. I'm going to go ahead and percuss again. And that should be anywhere from 3 to 6 centimeters, and that would be a normal reassuring finding to find that. So, next we will move on after the diaphragmatic excursion. We're going to go ahead and do auscultation of both the posterior, lateral, and anterior lung sounds. Take a deep breath. Oh, hold on. There we go. Deep breath. Okay. And again. And again. And again. Okay. Now I'm doing lateral. Deep breath. Okay. I'm going to switch around and come to the front here again. Deep breath. Okay. Okay, so that's good. We already, when we moved to the anterior chest here, we've already done an inspection. I said she had freckles, but there was no rashes or anything like that noted. As she's sitting here, her respirations are really nice and easy and even, and I have no concerns with that, so that's reassuring. Her breathing appears to me to be unlabored. I don't see any pulsations or heavings or accessory use or slumped breathing, so again, all of that is very reassuring findings. I'm going to start by going ahead and palpating the chest wall. No masses, no lumps or bumps. I am going to skip the breast exam and the vaginal exam because she has been to her OBGYN within last year and had both of those exams. But I will quick feel her axillary lymph nodes. So I'm just going to have you go ahead and kind of lift up for me here so I can feel. Okay, and again, no, I cannot palpate the lymph nodes, so that is a really reassuring finding, and that is on both sides. So that's really reassuring. So now I'm just going to go ahead and make sure that there is no thrills or heaves or pulsations as I'm doing this. And I'm going to go mid-clavicular line, and I'm going to go down to the 4th, 5th intercostal space, and I'm going to palpate there for the left chest apical pulse, which may be a little bit hard to feel with her sitting up here, but just slightly. Now I'm going to put my hands on her chest. Go ahead and say 99.
99.
Okay, and no crepitus noted, so that's really reassuring too. And now I'm going to go ahead and move to the percussion part of it. So, okay, so again, very reassuring findings. I have auscultated her breast sounds. Now we're going to go ahead and move to the heart sounds. So for this, I'm just going to have to kind of sneak in the front of your gown here. I'm going to go ahead and listen to the aortic area. Okay, and that's very reassuring. Now I'm going to the pulmonic area. Nice, regular, even rhythm. And now I'm going to go to the tricuspid area. Okay, nice, even, regular. And then I'm going to go to the mitral area. And again, nice, even, regular. And last one is the Erb's point, which is nice, even, and regular. Okay, I'm going to go ahead and have you lay down, and we're going to check your belly. Let me move this stuff here. Okay, so I see I have pants on here, so I'm just going to go ahead and bring this up here. For the abdomen, I can probably move to this side so that you can see what I'm doing here. For the abdomen, we're going to start with inspection. And on inspection, it looks appropriate color. There's no concerns. I don't see any obvious masses or pulsations. So after we inspect, we'll move to auscultation before we start palpating. So I'm going to go ahead and listen to all of her bowel sounds. Sorry, I didn't mean to scare you. Okay. Bowel sounds are nice and active, so now I'm going to go ahead and move to the arteries. We'll do the aortic first, and then the renal, and we'll listen on both sides. And then we're gonna move to the iliac. And lastly, the femoral. Okay, now we will move to the percussion part of it. We will start with the liver, which is here on her right side, and sorry. So you're gonna, okay, and then I'm gonna come over here to the spleen, and then I'm gonna go over. Okay, so again, all very reassuring findings. The next, we're gonna go to light palpation. I'm gonna go ahead and just palpate, and I'm gonna see if there's any masses. Just very light. We're just not gonna go deep right away. And you tell me if there's any tenderness. Any tenderness noted?
No.
Okay, so now we're gonna start here on the right side with deep palpation. I want you to go ahead and take a deep breath in and out. Okay. And I cannot palpate maybe just a little bit of that costal margin of the liver, so that's okay. We just want a little bit of it. Next, I'm gonna go ahead and move to her spleen. Go ahead and take a deep breath in and out. Okay. Good. And I can't palpate the spleen, but that's okay. That's not, you can't always palpate that. So next I'm gonna move to your kidneys. I'm gonna start by just putting your hand under your flank here. Go ahead and have you take a deep breath and out. Okay. And then again on this side, deep breath and out. Okay. So I'm gonna move to the aorta. Sorry. Okay, perfect. And as I'm palpating here for abdominal muscles, I don't feel any separations. I don't feel any hernias or anything like that. So again, always all very positive findings there. The next thing, before we get you up, I'm going to go ahead and peek at your legs here. I'm going to look at, there's no hair on her legs, so I'm not going to worry about hair distribution or anything like that. They're appropriate in color. Some freckles, but that's okay. No obvious masses or anything like that. No skin discolorations. I'm going to go ahead and feel her pulses. I am feeling her pedal pulses right now. And I'm going to move to her post-tibial and her popliteal. And when I do the popliteal, I am behind the knee. I just push down on that, I support that kneecap so it doesn't get pushed up. And then again. Okay, so as you're laying here, I'm just going to check your reflexes real quick. Or actually, first let's do this. Let's bring your leg up and bring it out to the side. Does that hurt?
No.
Okay. Up and out to the side. Does that hurt?
No.
Okay. Let's sit you up and we'll check your reflexes sitting up. I can help you up here. Okay. Go ahead and turn around. Okay, so next we're going to move on to the musculoskeletal. So I'm going to go ahead and check her reflexes here, and we'll start by her knee. Okay, good. Okay, so next I want you to go ahead and, like we did before, there you go, perfect. Okay. 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 So, all of the reflexes look good. Next, we tested your muscle strength up at the top when I had you squeeze and push. And what I do want you to do, because I didn't do this, I want you to pull towards you. Okay, and push. Push me away. Okay, perfect. Now I want you to push me away and pull towards you. Perfect. Okay. And now push up and down. Okay. So checked all the muscle strengths and those look good. No concerns there. One last part of the exam that I would like you to do, I want you to stand up and kind of lean over and touching your toes there. Okay, so I'm just gonna move this up so I can see your spine. Visualizing the spine, it looks nice and straight. And then I'm gonna go ahead and just walk up the spine and make sure it's nice and even. No curvatures noted, and all of that looks fine. And then I'm just gonna quick percuss up the spine. Okay, go ahead and stand up. You can go ahead and have a seat. I did forget to note that I did not note any edema on her legs. Nice, even skin tone, temperature is warm, so all of that looks very reassuring. That concludes our head to toe exam. Any questions or concerns you have for me?
Nope.
Okay, thank you very much for coming in.
Thank you.